Happy evening, viewers. Welcome to GarbhaSandesha. This is the 29th episode, and this is a special edition episode on the occasion of World IVF Day being celebrated throughout the month. Here, I would like to remind the viewers that GarbhaGudi is offering on IVF Day special package 20% on all blood investigations and 20% off on IVF injections. Please avail this offer. Only 7 more days are left. Please hurry up. And now coming back to GarbhaSandesha, today's topic is IVF. Since this being a IVF day month, we are having this special episode due to strong suggestions from viewers that we should have a special episode done on IVF process, A to Z explained. So to talk on this, we have two of our important doctors. And first is Dr. Chaithra S.K, who's our Assistant Medical Director at GarbhaGudi. Dr. Chaithra S.K is a well-known fertility specialist with more than 11 years of experience in the field. She completed her MBBS MS OBG from RGHS and fellowship in reproductive medicine and endoscopy the same year. She practices gynecology, infertility, endoscopy in Bangalore with high-level skills and knowledge of IVF. She has an utmost commitment, care, empathy towards patients. She has amazing success rates in IUI and IVF. Next, we have Dr. Anitha Manoj, who is a fertility specialist practicing at our Nagar Center. Dr. Anitha has more than 10 years of experience as a gynecologist. She specializes in infertility and holds a fellowship in reproductive medicine from RGHS. Dr. Anitha's prime motto is to ensure safe medical care for patients. She is a member of FOXI and the Indian Medical Association. Now, coming on the topic, I would like to throw the topics to both our panelists and take their take on that, IVF processes. Dr. Chaithra, would you please comment your first take on IVF process? Please unmute, madam. Yeah, please, your take on IVF processes, A to Z, like on our topic.
Okay. So IVF means it's in vitro fertilization. In a common man's language, if we have to explain, it is called the test tube baby. So what is in vitro fertilization or a test tube baby? It means that the normal fertilization process, which was happening inside the fallopian tube of a female, it would be happening in a lab, that is in the hospital, the IVF center's lab. So we give some hormonal injections to the female partner. The eggs, whichever grow, it will be retrieved, and this procedure is called oocyte retrieval. So we retrieve the eggs after say 10 to 12 days of hormonal injections, and the eggs which are collected, it will be mixed with the husband's semen, that is the sperms. So this fertilization will be happening in our IVF lab, and that's why it is called as in vitro fertilization. That is fertilization happening outside a female's fallopian tubes or body. So the embryos will be grown in our lab for about 3 to 5 days, and then the embryo will be transferred back to the womb of the woman. So this completes the IVF process. So it is nothing but fertilization happening outside. So once the embryo is transferred inside the womb of a woman, the woman will be put on some hormonal supports. And about 2 to 18 days later, when the pregnancy test is done, if the implantation has taken place, the woman will test positive for pregnancy.
Thank you, madam. Anitha, madam, I would like to ask you the first question. Who is the ideal candidate for IVF?
See, normally, will be like many patients, they'll come to our OPD asking, we are married since so and so long, like what is the next step? We are not able to conceive. So right away, for all the patients, we won't suggest IVF. So we'll be doing the basic evaluation, ultrasound, like both partners, female as well as male partners evaluation. And then we will, depending upon the reports only, we will be suggesting whether they can go for smaller treatments like ovulation induction and timed intercourse, or IUI or IVF. For IVF, we usually suggest for the people like mainly like age factor. That is where the both partners are like, especially the female partner is more than 30 plus, is more than 35 years, you say. And then married life also, like more than 4 to 5 years of married life without proper contraception. They've been trying and they're not able to conceive. So such patients with age factor. And then like report showing either like bilateral tubal block, where the tubes are very important, as madam suggested. Whatever happens in the tube, the same process we do in lab in case of IVF. That means if there is tubal pathology in that patient, so such patients, they have to go for IVF. So tubal block, and the patients with some diseases like severe PCOD patients, or like who has ovulatory dysfunction. That means they are not able to produce the eggs naturally, or even the egg quality is compromised even with the ovulation induction. So such patients, or people who have inherent other conditions like severe endometriosis, where the anatomy is totally distorted. So tubal pathology is affected there. So with the natural methods or IUI, conceiving will be difficult for them. And like multiple fibroids in the uterus, where the uterine anatomy is distorted. And then like where endometrial lining is damaged. And then the other factor is male factor, where like male factor means where the sperm count, motility, morphology is compromised. For them also IVF will definitely help. Or where there is nil sperms, we call it as azoospermia. In such patients also, we can retrieve sperms through like other advanced techniques and then go for IVF. So these patients are ideal candidates for IVF.
Thank you, madam. You have encompassed everything. Now, there is a question to Dr. Chaithra. Madam, this question is in Kannada.
Yeah.
Janamadhyamadavu keltidare. Madam, embryo transfer agi 27 days agide. Success agide. HCG level 12 days ge 140 ml ittu. Ivaga greater than 1500 ide. What is your take on that anta keltidare?
So usually embryo transfer agi ನಾವು if day 3 transfer ಮಾಡಿದ್ರೆ 16 days ಗೆ beta HCG check ಮಾಡ್ತೀವಿ. Suppose if it is like a blastocyst transfer, 14 days ಗೆಲ್ಲ check ಮಾಡ್ತೀವಿ. So ಇವ್ರಿಗೆ already beta HCG has crossed 1500. So the successful implantation ಅಂತ ತಗೋಬಹುದು. So ಈ ಸ್ಟೇಜ್ ಅಲ್ಲಿ ಸ್ಕ್ಯಾನ್ ಮಾಡಿಸಿ ನೋಡ್ಬೇಕಾಗುತ್ತೆ. ಬೇಸ್ಡ್ ಎಷ್ಟು ಎಂಬ್ರಿಯೋಸ್ ಹಾಕಿದ್ರೋ ಇಂಪ್ಲಾಂಟೇಶನ್ ಹೇಗೆ ಆಗಿದೆ, ಒಂದೋ ಎರಡೋ ಅಷ್ಟು ಎಂಬ್ರಿಯೋ ಅಂಟ್ಕೊಂಡಿದ್ಯಾ, ಗ್ರೋತ್ ಆಗಿದ್ಯಾ, ಇಷ್ಟೊತ್ತಿಗೆಲ್ಲ ಸ್ಕ್ಯಾನ್ ಅಲ್ಲಿ ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ಈ ಸ್ಟೇಜ್ ಅಲ್ಲಿ ಸ್ಕ್ಯಾನ್ ಮಾಡಿಸ್ಬಿಟ್ಟು ನೆಕ್ಸ್ಟ್ ಹಾರ್ಟ್ ಬೀಟ್ ಸ್ಕ್ಯಾನ್ ಎಲ್ಲ ಫಾಲೋ ಅಪ್ ಮಾಡ್ಬೇಕಾಗತ್ತೆ.
ಥ್ಯಾಂಕ್ ಯು ಡಾಕ್ಟರ್ ಚೈತ್ರ. ಲೈಕ್ ಜನಮಾಧ್ಯಮದವರೇ ನಿಮಗೆ ಉತ್ತರ ಸಿಕ್ಕಿದೆ ಅನ್ಕೋತೀನಿ. ಮೈ ನೆಕ್ಸ್ಟ್ ಕ್ವೆಶ್ಚನ್ ಇಸ್ ಅಗೇನ್ ಟು ಡಾಕ್ಟರ್ ಚೈತ್ರ herself. Madam, how long is the IVF process from start to finish?
So in IVF, there are about like two types of transfers. One is called a fresh embryo transfer. The other one is called a frozen embryo transfer. So generally the IVF is started from second day of a female's menstrual cycle. So the process of egg retrieval will happen roughly 12 to 14 days. Like you can take on 12th or 14th day of her menstrual cycle, we retrieve the eggs. Now, as I said previously, the fertilization process will happen in the lab and we allow the embryo to cultivate in the lab for about 3 to 5 days. So after this, if at all, if the female partner is actually suitable for a embryo transfer, so there are certain parameters to check, like her endometrial thickness should be good, her estrogen progesterone value should be under well control, so the patient is comfortable, we have given the right injections for her to do a fresh embryo transfer. So if she is fulfilling all the criteria, we can consider the embryo transfer as well in the same cycle. And if the patient undergoes fresh embryo transfer, then 2 weeks later we can do the pregnancy test and confirm. So if at all, if the patient is having a fresh embryo transfer, then in 1 month's time the patient can also have a result as well. So that completes the IVF process if she conceives. So it will take roughly 1 month's time. So there are certain patients who are not suitable for a fresh embryo transfer. Maybe their hormone levels have gone too high because of too many eggs being retrieved, or the patient might be having associated conditions, maybe a thyroid, she might require a diabetic control, or she might have given too many eggs where the fresh embryo transfer may not be safe. So in such cases, we freeze the embryos in couple's name, give her a cycle break of say 1 menstrual cycle where the ovaries will shrink back to normalcy. We have time for the patient to correct her comorbid conditions, and then we plan the frozen embryo transfer. So in circumstances of a frozen embryo transfer, this whole process happens over 3 menstrual cycles. In the first menstrual cycle, there will be egg retrieval and embryo formation. Second menstrual cycle, there will be break, and in the third menstrual cycle, we will do a frozen embryo transfer. So fresh cycle 1 month, it's a frozen cycle transfer, it might take approximately 3 months. So it all depends like what comorbidities are there, what additional corrections a patient require. When the patient is most ideal for a frozen embryo transfer, we plan in such menstrual cycles.
Thank you, madam, for the comprehensive answer. ಮೇಡಮ್ ಚೈತ್ರ ಮೇಡಮ್, ನಿಮ್ಗೇನೆ ಒಂದು ಕ್ವಶನ್ ಇದೆ. ಮಂಜುಳಾ ವಿ ಎನ್ ಅನ್ನೋರು ಬರೀತಾರೆ, ಹಲೋ ಮ್ಯಾಮ್, ನಾನು ಗರ್ಭಗುಡಿ IVF ಮಾಡಿಸಿದ್ದೆ, ಪಾಸಿಟಿವ್ ಬಂದು ಆಮೇಲೆ ಮಿಸ್ಕ್ಯಾರೇಜ್ ಆಯ್ತು. ಆಫ್ಟರ್ 3 months ಆಶಾ ಮೇಡಮ್ ಸಜೆಸ್ಟ್ ಬ್ಲಡ್ ಟೆಸ್ಟ್, ಇವನ್ ಕ್ಯಾರಿಯೋಟೈಪಿಂಗ್, RPL is normal, ANA is positive, autoimmune issue, what next?
So karyotype normal ಅಂತ ಬರ್ದಿಯಾರಾ?
ಹೌದು ಮೇಡಮ್, ಕ್ಯಾರಿಯೋಟೈಪ್ RPL is normal.
ಓಕೆ, ಸಿ ಅದೇ ಈಗ ಒಂದು ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಆಗಿ ಮಿಸ್ಕ್ಯಾರೇಜ್ ಆದಾಗ ಮೇ ಬಿ ಈ ಪೇಷಂಟ್ಗೆ ಮುಂಚೆ ಮಿಸ್ಕ್ಯಾರೇಜಸ್ ಇರಬಹುದು. ಸೊ ದೇರ್ ಆರ್ ಸರ್ಟನ್ ಇನ್ವೆಸ್ಟಿಗೇಷನ್ಸ್. ಈ ತರ ಮತ್ತೆ ರಿಪೀಟ್ ಆಗದಂಗೆ ಪ್ರಿಕಾಷನ್ಸ್ ತಗೋಬೇಕಂತ ನಾವು ಈ ತರ ಬೇಸಿಕ್ ಕ್ಯಾರಿಯೋಟೈಪಿಂಗ್ ಟೆಸ್ಟ್, RPL ಟೆಸ್ಟ್ ಹೇಳಿರ್ತೀವಿ. ಸೊ ಪೇಷಂಟ್ಸ್ಗೆ ಇದೆಲ್ಲ ನಾರ್ಮಲ್ ಬಂದಿದೆ. ಸೊ ನೆಕ್ಸ್ಟ್ ANA ಅನ್ನೋದು ಒಂದು ಟೆಸ್ಟ್ ಪಾಸಿಟಿವ್ ಬಂದಿದೆ. ಸೊ ಸಮ್ ಇಮ್ಯುನೊಲಾಜಿಕಲ್ ಫ್ಯಾಕ್ಟರ್ ಇದೆ, ಆದ್ರಿಂದ ಅವ್ರಿಗೆ ಇಂಪ್ಲಾಂಟೇಶನ್ ಪ್ರೋಸೆಸ್ ಫೇಲ್ಯೂರ್ ಆಗ್ತಿರ್ಬೋದು. ಸೊ ಈ ANA ಎಷ್ಟು ಸಿವಿಯರ್ ಆಗಿ ಪಾಸಿಟಿವ್ ಇದೆ, ಯಾವ ಕಾಂಪೊನೆಂಟ್ಸ್ ಅಲ್ಲಿ ಪಾಸಿಟಿವ್ ಇದೆ ಅನ್ನೋದು ನೋಡ್ಕೊಂಡು ಕೆಲವು ಪ್ರಿಕಾಷನ್ಸ್ ನ ತಗೊಂತೀವಿ, ಕೆಲವು ಮೆಡಿಕೇಶನ್ಸ್ ನ ಅವ್ರಿಗೆ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ಗೆ 1 or 2 months ಪ್ರಯರ್ ಇದ್ದಂಗೆ ಶುರು ಮಾಡ್ತೀವಿ. ಸೊ ಐಡಿಯಾ ಇಸ್ ಅವ್ರದ್ದು ಇಮ್ಯುನೊಲಾಜಿಕಲ್ ಇದೇನಿದೆ ಅದನ್ನ ಬ್ಯಾಲೆನ್ಸ್ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ. ಸೊ ಕೆಲವು ಸ್ಟಿರಾಯ್ಡ್ ಮೆಡಿಕೇಶನ್ಸ್ ಇರ್ಬೋದು, ಈ HCQs ಮೆಡಿಕೇಶನ್ಸ್ ಅಂತ ಬರುತ್ತೆ, ಲೋ ಮಾಲಿಕ್ಯುಲರ್ weight ಹೆಪಾರಿನ್, ಲೋ ಡೋಸ್ ಆಸ್ಪ್ರಿನ್ ಅಂತೆಲ್ಲ, ಇದನ್ನೆಲ್ಲ ಮುಂಚೆನೆ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಕೊಂಡು ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ನ ಫಾಲೋ ಮಾಡ್ತೀವಿ. ಒಂದ್ ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು, ಪೇಷಂಟ್ಸ್ ಕೆಲವು ಸತಿ ಎಷ್ಟು ನಾರ್ಮಲ್ ಇದ್ರು ಎಂಬ್ರಿಯೋ ಏನಾದ್ರು ತಂದೆ ತಾಯಿ ನಾರ್ಮಲ್ ಇರ್ತಾರೆ, ಪೇರೆಂಟ್ರಲ್ ಕ್ಯಾರಿಯೋಟೈಪಿಂಗ್ ಎಲ್ಲ ನಾರ್ಮಲ್ ಇರುತ್ತೆ. ಬಟ್ ಈ ಭ್ರೂಣ ಆದಾಗ, ಎಂಬ್ರಿಯೋ ಫಾರ್ಮೇಶನ್ ಆದಾಗ ನ್ಯಾಚುರಲ್ ಆಗಿ ಕೆಲವು ಎರರ್ಸ್ ಆಗಕ್ ಸಾಧ್ಯ, ಅದು ಪ್ರಕೃತಿ ನಿಯಮ, ಕೆಲವು ಎರರ್ಸ್ ಆಗುತ್ತೆ. ಸೊ ಅಂತ ಎರರ್ ಇರೋ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಆದಾಗ ಅವ್ರಿಗೆ ಈ ತರ ಮಿಸ್ಕ್ಯಾರೇಜಸ್ ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಸೊ ಒಂದ್ ಸತಿ ಮಿಸ್ಕ್ಯಾರೇಜ್ ಆದ್ರೆ ಎಲ್ಲಾ ಸತಿನೂ ಅದೇ ತರ ಆಗುತ್ತೆ ಅನ್ನೋದು ತಪ್ಪು. ಬಟ್ ಆಸ್ ಅ ಪ್ರಿಕಾಷನ್ ನಾವು ಇನ್ವೆಸ್ಟಿಗೇಷನ್ಸ್ ನ ಮಾಡಿರ್ತೀವಿ. ಸೊ ಈ ತರ ಏನಾರ ಇಮ್ಯುನೊಲಾಜಿಕಲ್ ಟೆಸ್ಟ್ ಪಾಸಿಟಿವ್ ಬಂದ್ರೆ ಅದಕ್ಕೂ ಟ್ರೀಟ್ಮೆಂಟ್ ಹಾಕೊಂಡು ನೆಕ್ಸ್ಟ್ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಪ್ರೊಸೀಡ್ ಆಗ್ಬೋದು. ಸೊ ದ ಚಾನ್ಸಸ್ ಆಫ್ ಲೈವ್ ಬರ್ತೆ ಜಾಸ್ತಿ ಇರುತ್ತೆ ಹೊರತು ಚಾನ್ಸಸ್ ಆಫ್ ಅಬಾರ್ಷನ್ ಡ್ರಾಸ್ಟಿಕ್ ಆಗಿ ಕಡಿಮೆ ಆಗುತ್ತೆ.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಮಂಜುಳಾ ಅವರೇ, ಅತಿ ಶೀಘ್ರದಲ್ಲಿ ಮತ್ತೆ ಬಂದು ಭೇಟಿಯಾಗಿ. Next question is to Dr. Anitha. Madam, food habits before someone starts IVF.
See, ಈ question on doctor ಹೇಳ್ಬೇಕಂತಿಲ್ಲ. Actually, it's only to explain about the food habits every one of us know. So healthy habits will always help. As a doctor, our responsibility is only to give medications and give suggestions. How they act and how you make them act is in your hands. Like going for healthy habits, like quit smoking, alcohol, or some like if you are a frequent outside eater, outside food, you should avoid that. And then go for healthy habits also, like daily exercise, that is minimum half an hour to 1 hour minimum exercise. And then fresh vegetables and fruits, which are rich in antioxidants, all these things. And healthy lifestyle, basically healthy lifestyle and good amount of exercises, thereby increasing the blood supply even to the reproductive organs and other things, keeping the weight under check, our weight under check, avoiding the weight gaining food, especially more of carbohydrates and that tubers, all these things we should avoid. And other than this, we will be giving supplements like multivitamins and all, we will be giving supplements. And then clothing also should be in a healthy way. And we should try to see, it's very difficult to avoid stress, I know, but we should we should overcome the stress, try to minimize it, divert yourselves, keep your mind calm. And then this stress might, like, it can affect the sleep also. That sleep disturbances should be under control. You should control that. So all these things, this lifestyle changes will bring a lot of changes in the treatment outcome also.
Thank you, Doctor. Chaithra Madam, is bed rest required after embryo transfer?
This is the biggest myth the patients are having. So embryo transfer literally we should not move, we should be taking complete bed rest another. They will be having this myth in their mind. So this actually can be detrimental for patients' health. So normally when we do an embryo transfer, we will put quite a bit of hormones. It could be estrogen, progesterone and all. So because of these hormones itself, there is a tendency in the body to have blood clots and all. So that is one of the side effects of this hormonal treatment. So added to that, if the patient is literally not moving, there is a chance that the clot formation chances will increase. It will affect the blood supply to the reproductive organs, which can in fact affect their chances of implantation. So no patient should be under any sort of bed rest or any sort of restriction. So we always advise soon after embryo transfer, patient can actually resume her normal activities. We only suggest that there should not be an excessive travel or too much of physical strain to the body. So that is what the advice generally given. That most patients take it in a wrong way and go for a bed rest and all, which can be detrimental. So we can be as normal as possible after an embryo transfer, and the implantation process happens in a very closed environment of uterus, which definitely is not affected by a patient's movements or bed rest or anything of that sort. So ideally the patient should be having normal activities after an embryo transfer, taking medications on time, taking a healthy diet, keeping the mind calm and stress-free.
Thank you, Doctor. Anitha Madam, is IVF painful?
Definitely no. See, as Dr. Chaithra explained, IVF process, Madam explained in a beautiful way. Like from second or third day, the injections will start on, like 10 to 12 days will be the course. The injections are they're not painful injections and all, like normal injections only. Most of them are subcutaneous. Even the intramuscular injections are not painful. After that, when the eggs will grow to certain age, we'll be going for the egg retrieval or oocyte retrieval. That will be done under anesthesia only. So patient definitely won't feel pain. So that day after the egg retrieval, patient might feel some discomfort in the lower abdomen. That's all. By the next day, they will settle down. Usually they will become normal. So it is not a painful process at all. And the embryo transfer will be like normal, how we do an examination, like gynec examination. It will be like that only. It is definitely not at all painful. So even if anyone is thinking or scared that IVF process is a painful process, it's difficult for me to tolerate pain, please come out of that fear. It is not painful.
Thank you.
This is another big myth in their patients' mind. Many patients actually don't opt for IVF thinking that it's quite a bit of painful process. Other patients scare them with these injections and all. So as Dr. Anitha explained, most injections are subcuticular injections, like how we take insulin injections. They are as thin as those needles, and the injections are quite painless, and the procedures are done under anesthesia. So it will be a smooth ride for patients without any pain.
Thank you, madam. The next question comes to you, Dr. Chaithra. What is IVF from home? What are the advantages?
Okay, so this actually started during the pandemic and all, and in foreign countries, most injections are administered at home only. So as we were telling, that most IVF injections are subcuticular injections, and they are actually available in the form of pen devices. So how these diabetic patients take insulin injections at home only, like self-administrable. So even IVF injections can actually be self-administered. But what we emphasize in GarbhaGudi IVF Center is that since these injections are cold storage injections and a proper cold chain has to be maintained, we have this option of our IVF nurses going to home and administering these injections in a proper cold storage chain itself. administrating the injections at the right time, so that the patient need not visit the hospital. So she is advised to visit hospital only when they are actually having some scans only. Even blood tests can be done from home, where our nurse will go and collect the blood. So accordingly, we'll adjust the dose of the injections, and the nurse will go back and administer the injections to the patient. So this is what we call IVF from home, only for the egg retrieval procedure or for an embryo transfer, or in between for few scans only the patient is required to come to the hospital. So all these things can ease out a patient's stress of travel, sitting in the hospitals, avoiding unnecessary transmission of infections. This was especially true during COVID times and all. So all these things as a patients, especially couples who are working, or those couples who are working from home, it will be very easy for those patients to undergo this IVF treatment without much travel or stress.
Very well explained, madam. Thank you for that explanation. Dr. Anitha, what are the potential side effects of undergoing IVF?
Yes, sir. See, this is one most of us will be worried about to undergo IVF because of the complications. They'll think so many things, but actually not much complications. But significant side effects means multiple pregnancies. Like if we are going under, like the patient is undergoing IVF and embryo transfer, we usually tend to transfer 2 embryos. So that means if both of them get implanted, they can go for either twin or sometimes rarely triplets also. That is multiple pregnancies. Another main severe, another worried complication is over response to the treatment, that we call it as ovarian hyperstimulation. So instead of what we expect, they will over respond, and this can lead to other side effects in the female patient. The other minimal or minimal side effects, like from the time of injections administration, they might have some rashes like thing around the site of administration, but nothing to worry about it. And then they might feel nausea, like vomiting like sensation, nausea, bloating sensation, and then they might feel somewhat giddiness. These are the minimal side effects of the drugs. And main complications are multiple pregnancies and OHSS. And during the procedure, like during egg pickup, chances of injury to the adjacent structures, which is very rare, but still this complication also will be there, and we will explain the patient. And this hyperstimulation, that over response, will be seen mostly in that severe PCOD patients, where multiple eggs will be there. For them, chances of developing more eggs will be there. So because of this, they might go for more fluid loss, like inside there will be fluid loss, and they might feel vomiting sensation, sometimes pain abdomen. So all these things will be there that will be taking care properly. So such patients.
Thank you, madam. Dr. Chaithra, is there anything that could negatively impact IVF success?
There are so many factors, like in the sense with respect to diet, or what it is negative.
Negative. Is there anything negative that could impact IVF success?
See, the thing is, we have to first understand for what reason we are doing IVF, what is the cause of infertility. We have to keep in mind the patient's age and also their previous treatment history in mind. So that is very important. So many patients who come to our GarbhaGudi IVF center, they might have already failed multiple times, or at least one IVF failure will be there. So it's very important for us to assess what is their cause of infertility, what could be contributing to their cause of infertility, how has been their previous treatment, what was done, and what could be the possible reasons why the patient has failed. So based on all these factors, we have to formulate our own treatment plan, which is actually individualized. It is not like all patients will have the same kind of treatment protocols. So it is the individualized approach to each patient based on their needs, their infertility factors, their previous histories, treatment thing, which decides the protocol for this one. So we make sure that the patient is undergoing all those things, and then make sure that the best quality embryos are formed and it is transferred to the patient. and all those negative things which can actually affect their success rates will be taken care. So that is the uniqueness of GarbhaGudi, where we actually follow this individualized approach, assess everything before to an embryo transfer, especially for those patients who have failed in the past or those who are having multiple treatment failures. So we have many such examples where the patient has already lost hopes and have come to GarbhaGudi and have achieved successful pregnancy. So if I have to name one patient, that patient had a nil sperm count. So they were already tried a testicular, like surgical aspiration of sperms, and told that it is not possible to have a pregnancy. So they were actually counseled for a donor sperms, IUI with donor sperms. So when such patient came to me, all we did is do a genetic test of the husband to understand why he had nil sperms and repeated the testicular biopsy. So we got to know that the husband had a genetic error, but still on the testicular biopsy, we got few sperms. So we used those sperms for IVF treatment and actually tested those embryos because husband had a genetic error called balanced translocation. So we tested the embryos and transferred a normal healthy embryo into the womb of his wife, and she successfully conceived and have delivered a baby. So this is called as like IVF with PGTA, testing the embryos before the embryo transfer. So we have enormous such success rates where the patients have completely lost hope and have come to GarbhaGudi and have actually conceived successfully. So it is this individualized approach to patient care, no, makes us stand out like from other IVF centers.
Super, madam. Thank you for that explanation.
Thank you.
Now, Anitha madam, where are eggs, sperm, embryos stored? That is after retrieval.
See, normally, a female patient, she wants to conceive later. She is planning for pregnancy later because of so many reasons, like present day situation that career oriented. So for them, even if they're not married, also they can go for stimulation, store the oocytes or eggs, and then even if they're planning, if they're married couple, if they're planning for pregnancy later, they can go for direct embryo freezing also. So all these eggs, whatever, or sperms, if a husband is undergoing treatment, either it's husband or a male is undergoing treatment for something, for example, cancer, then these patients also, they can, prior the treatment starts, like chemotherapy, they can store their either eggs or sperms. So these eggs, sperms, embryos, they all will be stored in the nitrogen tanks, well labeled, and they will be like well documented also. Proper documentation also will be done, like in future, like what will be done with the embryos, and they can be stored up to 10 years, 15 years also. So nothing will happen.
Thank you,
So,
madam.
we have liquid nitrogen tanks. So we have separate tanks for an infected sample, separate tanks for a non-infected sample, and the documentation will be such that we actually exactly know which tank the couple's embryos are stored. It will be properly labeled. There is separate storage system inside also, where we document where exactly is the location of embryos or semen or eggs of a particular patient. So there is no chance of any mixing or cross-infection, cross-contamination of anything. So such is the system where we store the embryos, so that the patient can store their gametes or embryos for any number of years, and it will remain dormant in same state, and it will, when we actually thaw and bring it to a normal temperature, it will have good survival as well, and it can be used after any number of years. So that is the biggest advantage of all this embryo vitrification or a oocyte vitrification or a semen vitrification.
Thank you, madam. I would like to remind our viewers that because of World IVF Day, whole of this month, we are having 20% discount on blood investigations and 20% discount on IVF injections. Please avail this offer. Only 7 more days are left. Now, the next question is going to Dr. Chaithra. Madam, what does day 3, day 5 transfer mean?
Okay. See, it all depends on what is the institutional protocol. So once on the day of egg retrieval, we collect the eggs, we inject with husband's sperms, and the embryos are allowed to grow inside our lab for about 3 days. So after 3 days, the embryo forms a day 3 embryo. So this day 3 embryo will be roughly in an 8-cell stage or a 10-cell staged embryo. So most institutes have this protocol to freeze the embryos on day 3. So that is called a day 3 embryo. So if we are transferring the embryo in this stage itself, it is called a day 3 embryo transfer. So some institutes extend this culture of day 3 embryos to 2 more days extra in the lab itself. So this embryo will get converted to 2 more days embryo. That is called a day 5 embryo. It is also called as a blastocyst embryo. So it is the challenge lies here. If at all, if your embryonic culture conditions are very good, then only the embryo will go past that stage of day 3 and reach a stage of day 5. And of course, it also depends on the intrinsic factors of the embryo as well. Only if a embryo is normal, it will actually reach that stage. So this switch over from day 3 to day 5 is a good sign that the likely that the embryo will be normal, and the switchover will happen only if you are having an excellent culture condition, which probably requires a trigas incubator like that. So that advanced culture system is required for this. And when embryos are stored or transferred as a day 5 embryo or a blastocyst embryo, we have higher success rates. So in GarbhaGudi, we have this institutional protocol of culturing all embryos to day 5 and actually plan a day 5 embryo transfer, which has given excellent success rates. It can actually bring down abortion rates and give very good success rates to couples. So that is what we follow at GarbhaGudi, a day 5 embryo transfer.
Thank you, madam. Anitha, madam, why is it necessary to have so many eggs while undergoing IVF?
As I already told you, like usually 2 to 3 embryos will be transferred. So like like as madam said, day 3 and day 5 transfers. If we are going for day 3 embryo transfer, we usually tend to transfer like more than 2, like 2 or 3 embryos. And then if it is day 5, that is blastocyst transfer, we will do either single blastocyst transfer also or the 2 blastocysts also. If a patient, if couple are already having one baby, then we usually go for single transfer. And if like this is the first time transfer, then we might like with the patient's consent, with the couple's consent, we go for 2 blastocyst transfer. Why we have to do means to increase the success rate only. We are doing this multiple, like even if one embryo fails to attach to the endometrium, that is the uterus lining, the other embryo might do it. So we don't know the inherent, like as Dr. Chaithra said, it is the inherent properties of the embryos which decide whether they grow or not in the culture conditions. So similarly, the same factors will decide whether they will attach to the lining and grow or not. So implantation takes place. So to increase the success rate only, we'll be transferring multiple embryos. To have this, we want more oocytes, more embryos. So even if the patient becomes positive and the pregnancy continues, she'll get a healthy baby in the first attempts itself. If she has extra embryos, those embryos will be frozen and they can be used for future pregnancies. Yeah. Even if they get more also, like no need to discard them. So, so for such purposes only, we expect like more oocytes and more embryo formation. And if we, for example, like say we stimulated a patient, we got around 10 oocytes on the oocyte retrieval day. For like last pickup, we got 10 oocytes. So when we did fertilization, that is, we injected the sperms to all of them. See, all the 10 oocytes, they may not be mature oocytes also. What we need is like mature. We call it as M2 stage. So all of them may not be mature. See, for example, that patient had, out of 10, she had 8 mature oocytes. In that 8 mature oocytes, we injected all these 8 mature oocytes with the husband's sperms. So the next day, all the 8 oocytes after they won't get fertilized. In that, only 6 got fertilized to next stage. And when we left them for 3 days, out of them, maybe like 5 or all 6 might not grow. For her, only 5 grew. And then we went on till the blast stage. Only 2 or 3 will form the blast, depending upon the quality of the oocyte as well as the sperm. That is why, see, we got 10 when we did the oocyte retrieval. But finally, how much we got? We got only 2 embryos, that is blast stage. See the number difference. That is why we want more number of eggs.
Thank you.
So very beautifully explained. So more number of eggs, yes, but still the final outcome might be 2 embryos, which could be actually sufficient for a successful pregnancy. But that does not mean that patients, especially we do IVF for one another important reason called low reserve or low AMH, where the patients will be having hardly 2-3 eggs, and we collect those 2-3 eggs itself, and maybe it might result in formation of 1 embryo or sometimes 2 embryos. So there will be eggs which will be collected in multiple cycles, so that we get more number of eggs, resulting in more number of embryos, so that the success rates also improve. So again, I would like to emphasize here, like we have had many patients where had single eggs, like during egg retrieval we have got only 1 or 2 eggs, going on to have a successful pregnancy as well. So yes, number matters, but there are plenty of patients even with low reserve, when the right treatment, right pre-treatment is given, a good culture conditions is given, a normal egg will definitely result in a good embryo formation, which can actually result in successful pregnancy. So ultimately we have to understand that a pregnancy happens from a single egg, single sperm only. So it is that particular embryo which we require for a successful implantation. So patients who have less eggs, having hardly 2-3 eggs, need not get disappointed. Even with those 2-3 eggs, we can actually achieve a successful pregnancy. And that is what we call as IVF pooling cycles, where we pool the eggs over multiple cycles and actually give a pregnancy which has excellent results these days.
Thank you, madam. That's all we have time for today's topic. I would like to remind the viewers again about our World IVF Day offer: 25% on blood investigations, and 20% discount on IVF injections. Please do avail this offer. 7 more days to go. And thank you, doctors. Thank you for speaking on this